Welcome back to another episode of Health Insurance Unraveled. I'm your host, Travis Stallman. I'm a licensed Medicare broker. Today, we are going to start our trip down the election periods path. Election periods, also known as enrollment periods, basically allows you the opportunity to switch your policy. So you can't just switch your policy at any time, depending upon the policy that you have. So today we are going to cover the differences between the annual enrollment period versus the open enrollment period, and specifically the open enrollment period for Medicare Advantage and Medicare Advantage prescription drug plans. So we're going to cover what we just went through, October through December, as well as what we are currently in right now, January through March. So let's get started. So AEP, also known as the annual enrollment period, that begins technically October 15th. We in the field, as well as you might start receiving mailers beginning of October, October 1st. That's the soonest that anybody who's licensed to discuss Medicare policies can actually begin talking about policies for the following year. So October 15th through December 7th, that is the actual election period. So if you ever made a change of your policy between the 15th of October and the 7th of December, for the first of the following year, you probably did it during that time frame. January 1st is when those policies go into effect. So if you made a change, let's say you were with ABC Insurance Company in 2022, you received a call and you're like, oh, you know what? This policy sounds like it offers better dental, vision, covers my doctors, covers my medications. I want to switch to that policy. More than likely, whoever you worked with used the AEP or annual enrollment, annual election period election to switch you over. And then that policy began for you the 1st of January. Those elections for the annual enrollment period are good for Medicare Advantage plans, prescription drug policies. You can also drop your coverage at that time and go back to original Medicare if you wanted to. So AEP is basically out there for the majority of insurance policies out there, whether that be Medicare Advantage, Medicare Advantage prescription drug plans, prescription drug policies, or if you just wanted to go back to original Medicare. Those policies, once again, if you use those election periods, they go into effect the first of the following year, which is January 1st. So October 15th, December 7th every year, you're probably seeing those Joe Namath commercials on TV. Those represent, once again, the annual enrollment period. That is for Medicare recipients. After the annual enrollment period ends, January 1st, you get your insurance card, you try out your new policy, you stay with the policy you were on last year, and you're like, you know what? Not for me. I don't want this policy. It's not what I thought it was. I need a little bit more dental. My doctor's no now out of network. Can I change? Do I have to wait until next year? Well, the lesser known election period that is gaining a little bit more momentum out there in the media is the open enrollment period, otherwise known as OEP. Now, today, there are multiple different types of open enrollment periods out there. We're going to cover the Medicare Advantage and Medicare Advantage prescription drug open enrollment period. That open enrollment period runs January 1st through March 31st. There are some big differences between the annual enrollment period and open enrollment period. Sometimes between October and December, you see ads that say, oh, it's open enrollment period. Not technically open enrollment period. That begins January 1st, goes to March 31st. The open enrollment period specifically for Medicare Advantage and Medicare Advantage prescription drug recipients. If you have any type of Medicare Advantage policy between January 1st and March 31st, you don't like that policy, you spend Valentine's Day with somebody and you're talking to them and you're like, hey, you know what? I have XYZ insurance policy. I get $500 in dental. The other person's like, well, I get $4,000 in dental. Well, I want that policy. How do I switch? So you can contact the insurance broker, myself, your current agent, whoever you trust with your health insurance, and see if you qualify to make a change during the open enrollment period. It always begins the next month is the effective date. So what that means is if you use the open enrollment period in the month of January, your policy will start February 1st. If you make a change in February, your policy starts March the 1st. You make a change in March, policy starts April the 1st. So your next effective month is basically the first of the month of the following of the election that you use. So once again, if you use the open enrollment period to switch your Medicare Advantage policy, in January, starts February. If you use it in February, it starts in March. Use it in March, starts in April. The one thing with this is you can only use it one time. You cannot use that more than multiple times in a given year. So if you do make a change, make sure it's a change that you want for the long haul, because if you don't have a special election period, and we'll cover those in the upcoming videos here, you may end up with this policy, whatever it is that you switch to, up until the next annual enrollment period, unless you have a special election period. Once again, we'll cover those in upcoming videos. So the big difference between the annual enrollment period runs October 15th to December 7th. Those policies started the 1st of January for you. That election period can be used for basically any type of Medicare policy out there, such as Medicare Advantage, prescription drug plans, original Medicare. There are exceptions to the rule. However, pretty much any insurance policy, Medicare Advantage, prescription drug plan, original Medicare, you can make those changes during the annual enrollment period. Open enrollment period specifically for Medicare Advantage prescription drug recipients, January 1st, March 31st. Next month effective begins the first of the following month, and one-time use only. You can only use that election period one time during that time frame. So if you did make a change in January, for February, you try that policy out for February, you don't like it, you can't use it again in March. You would need a special election or special enrollment period to make a change. If you have any questions on this, you always feel free to reach out to myself. My contact information is located on my page information here. Otherwise, this has been Health Insurance Unraveled. Thank you for watching.